What's up guys, it's John here at Directive, and today we are going to talk about something rad, reactive attachment disorder. I'm going to be talking about what is a reactive attachment disorder, as well as who is likely to get it, what may cause it, how it could be treated. But before we move on to that, I'm sure you already know by now that I have a strong attachment to that like button being pressed. So let's hit that like button for our YouTube algorithm and let's get right to it. So what is a reactive attachment disorder? A reactive attachment disorder is a condition in which the baby or a child does not form a secure and healthy bond with their main caregiver. And who is likely to have this disorder? Children between the age of 9 months to 5 years old, who have experienced either a physical or emotional neglect. Now, the neglect could be either intentional or unintentional. For example, because of the circumstances, the child may be needed to be taken care of by multiple caregivers, in which they will have a tough time forming a strong bond with what would be a main caregiver. Another way they could also develop this disorder is if they have already formed a very strong bond with their main caregiver and that caregiver suddenly becomes absent. A typical example of that is once the baby forms a very strong bond with mom and dad, and they may develop this disorder during the transition in which they have to move to the daycare. Reactive attachment disorder can easily form if the baby or the child feels that their needs are not being met at a consistent basis. And with their needs not being met on a consistent basis makes it harder for them to form a secure and healthy bond with their main caregiver. What are the typical examples of inconsistent care? A baby whose diaper is wet and soiled but is not changed for long periods of time. A baby who is hungry and yet who is not fed for an extended period of time. A baby who is crying but is not attended to. A baby who has limited amount of physical touch and interaction with their caregivers. Or an infant whose needs are only met time to time at a very inconsistent basis. If the baby has been either emotionally or physically abused, this would definitely likely to cause a reactive attachment disorder. But there are sometimes certain causes that may not be so obvious that could also trigger a reactive attachment disorder. And that is when they are introduced to a new sibling at a young age. So if the age gap between your eldest and the youngest is very close, it is possible that the oldest feels that his needs are being neglected when the newborn is introduced to the family. And this is understandably so because the newborn baby does require more attention by the parents. And because of that, the eldest child may feel that they are being neglected because they don't feel that they are being attended to the level they were before the second baby arrived. So what are the possible symptoms of a reactive attachment disorder? The biggest red flag is when your child is not showing the expected range of emotions when interacting with others. And there could be either no signs of remorse or guilt or regret. They could also be avoiding eye contact and physical touch with the caregivers. And they could also be throwing a lot of tantrum and show irritability beyond to the point where it would be considered normal. And lastly, displaying overly inappropriate affection to other strangers while being fearful or not really showing any of those emotions to the main caregiver. So how is the reactive attachment disorder treated? The possible options are either counseling, family therapy, social skills intervention, special education, and parenting skill classes. So most of these treatments actually focuses on the parents. The reason for this reactive attachment disorder is because the child has had a difficult time forming a secure and healthy bond with the caregiver. And a lot of times that is beyond the control of their own. And it is up to the parents to be able to handle and change the situation so they can actually start to rebuild that trust so they can form a proper bond with their mom and dad. So what could be the possible complications if you were to leave the reactive attachment disorder untreated? There could be developmental delays in both mental and physical growth. They are more likely to develop emotional problems such as depression and anxiety. They're more prone to develop an eating disorder. Given that this is the first relationship and the first social relationship that they form as a baby, This could lead into a multitude of problems when it comes to relationship when they grow up into adulthood. So make sure that when you're taking care of your child, that you're consistent with your care. If there seems to be any signs that shows that your child could be developing the reactive attachment disorder, think about what changes there has been. And if you do notice any of these symptoms, contact your pediatrician. Guys, I hope you found the information useful, and if you did, please hit that like button and subscribe for more videos like this in the future. I post on Mondays and Thursdays with tips and information that could help other parents and expecting parents out there. As always, thank you for watching and happy parenting.